Hello, my name is Justin Gaddy, and I'm a candidate for MS in Applied Nutrition at University of New England. This is for course APN 760, Micronutrients, and I will be presenting on a systematic literature review regarding the efficacy of riboflavin in treatment of migraine headaches in adults. The objectives of my presentation are as follows. I'll begin with an introduction and background on the subject matter. I'll present to you my research question, which I'll be reviewing. Then I'll go over the methodology, how I actually searched and then selected the literature I did publish here. Excuse me, not publish, but review. I will then discuss, I've included 6 studies that I've reviewed. Then I'll produce a visual abstract, which compares all the results. I'll give you my final conclusion and an evidence grade. Then I'll discuss the limitations and strengths. Then the implications for research, possible future studies, and then also for practice and clinicians. Then I'll supply my references. So migraine in adults, it's more than 37 million Americans suffer from migraine, and it is considered a vascular headache. The most common experience between the ages they found 15 and 65, and 70 to 80% of sufferers also have had a history of migraine in their family. Currently, there's no test to confirm a migraine diagnosis versus another headache type, but the clinician will diagnose that. At least 5 headaches per attacks per month, and they last anywhere from 4 to 72 hours each. These headaches are often one-sided, pulsating pain to moderate to severe intensity. They are aggravated by or causing avoidance of routine physical activity. So either way. And they are often accompanied by at least one of the following: nausea and or vomiting, photophobia, which is a hypersensitivity to or avoidance of light, phonophobia, which is a hypersensitivity to sound. Migraines in adults continued. Many factors may contribute to the occurrence of migraine attacks, also known as trigger factors. These can include diet, sleep, activity, psychological issues, and many other factors that we don't completely understand yet. There are several treatment choices for the patients currently. There are first-line medications. There are calcium channel blockers. There are NSAIDs, and then a variety of antidepressants. There are also nutrition interventions such as riboflavin or vitamin B2, which I'll be studying and presenting. They have found that riboflavin has a protective role against migraines, and on the next slide I'll show you the mechanism. Riboflavin is also a precursor of 2 enzymes, flavin mononucleotide and flavin adenine dinucleotide. These are also involved in the transfer of electrons in oxidation reduction reactions. And you can see on the next slide the proposed protective role of riboflavin. And you can see both sides of it, the migraine protection and the migraine triggering of other interventions and other factors. They've also found that low vitamin B2, riboflavin, may contribute to migraine pathogenesis. So my research question is, among adults ages 18 to 65, how does supplementation with riboflavin affect the symptoms of migraine headaches? My methodology, or my search and selection strategy, I started and incorporated the preferred reporting items for systematic reviews and meta-analysis, or the PRISMA guidelines. I use a literature search consisting of PubMed 2007 to 2019, And I searched the medical subject headings or the mesh terms, riboflavin, migraine, and adult. I also looked at the Web of Science from 2007 to 2019 and also searched the same terms, riboflavin, migraine, and adult. I only used English language articles and then also narrowed the search down to human subjects only. Methodology continued. I have included the inclusion and exclusion flowchart for my literature review. I did start off, and with those specific terms, there weren't that many within those years. I identified 11 at first, nothing through additional resources. Then I did have still 11 after the duplicates were removed. I screened all 11 of those articles. Then I included the full text articles and I assessed those for eligibility, in my inclusion. The full text articles that were excluded had either a pediatric population or a combination riboflavin prophylaxis. So it would either include CoQ10 or magnesium or feverfew in additional to that. So riboflavin wasn't a sole intervention. Then I was able to narrow it down to my qualitative synthesis of 6 articles. So the 6 articles to be discussed are listed here, and I'll go over each one of them and discuss the evidence that I've found. The first is Hoffman in 2019. They strongly recommended riboflavin for migraine treatment based on minimal side effects in adults and high efficacy to reduce the migraine frequency. They reviewed 5, number 317, studies with adults 18 to 65 years old. The intervention group received oral riboflavin, 100 to 400 milligrams daily for 3 to 6 months. Then they were compared, they also reviewed compared to patients taking the placebo, propranolol or sodium valproate in 3 random controlled trials and to patient baselines in 2 case series. In a placebo-controlled trial, 3 months of riboflavin decreased migraine frequency by 59% compared with placebo. In 2 case series, comparing riboflavin to baseline data, riboflavin was associated with a decrease in migraine frequency of 67% and 50% sequentially. In addition, they also found that riboflavin at 400 milligrams given over 3 months reduced frequency of migraines in adults by over 50%, and these are the accumulation of their findings from their reviews. Also reviewed that the 2012 Canadian Headache Society, and they haven't changed this recommendation since, as far as I know, strongly recommended, based on benefits versus harms, riboflavin for the migraine prophylaxis in adults. There may be implications for practice that have common side effects for riboflavin that Hoffman found were GI symptoms, urine discoloration, polyuria. There are limitations of the study. There were heterogeneous study designs and outcome measures, short study durations, and small sample sizes. The second article I reviewed was by Thompson in 2017. They reviewed current research that was consistent with the prior findings that riboflavin had been effective in the prophylaxis of migraine headaches in adults. Implications for practice are consistent, they found, with level B evidence that's additionally demonstrated by the American Academy of Neurology. A clinical advantage to using riboflavin is the prophylaxis of migraine headache they reviewed its excellent tolerability, its low cost, and minimal adverse effects. Also, they found therapeutic doses used in clinical trials are substantially higher than the amount taken as a vitamin supplement. So riboflavin doses to treat migraine headaches range from 50 to 400 milligrams a day, with the most common dose of 400 milligrams a day. But there were some questions that were brought up. If the maximum amount of riboflavin that can be absorbed after a single dose is 27 milligrams that they reviewed in prior research, the question remains as to why more than this would actually be given as a single dose. So there are questions as to the limited active absorption of riboflavin, the relatively short plasma half-life, and the emerging data on pharmacogenomics that they found. There's limited information on the absorption of riboflavin that it suggests it involves an active transport mechanism with the maximum dose of 27 milligrams absorbed after a single oral dose. The next review was by Namazi in 2015, and they investigated the current evidence of riboflavin on adult prophylaxis in adults. They included databases of PubMed, ScienceDirect, Google Scholar, and Springer between 1990 and December of 2013. Overall, they found 7 studies with adults that indicated a positive role in reducing frequency and duration of migraine attacks. Adults 18 to 65 were given 400 milligrams a day for 3 months. They also concluded that riboflavin is a safe and well-tolerated treatment option for the prevention of migraine symptoms in adults. The next study is by Ramindal in 2015, and they concluded and they conducted a randomized clinical trial, or RCT, evaluating the effectiveness of riboflavin compared to some other common migraine medications, in this case sodium valproate. This is a single-blind clinical trial conducted on 90 migraine patients in 2 parallel groups. First group underwent vitamin B2 treatment, 400 milligrams a day for 3 months. The second group was treated with sodium valproate, 500 milligrams a day, also for 3 months. Then after the 3 months, both groups saw the reduction in frequency, duration, and severity of migraines at about the same levels. But they conclude that riboflavin was preferred due to less side effects. In addition, they also found that the frequency, the median duration per month, and severity of the headaches decreased in both groups, but the difference between them was not significant enough. However, there were significantly fewer side effects in the vitamin B2 group riboflavin. There were limitations of the study. The lack of the International Headache Society criteria for migraine headaches. There was also insufficient statistical analysis of baseline differences between groups and associated comorbidities. And there was also a single-blinded nature of the study. The next piece of literature I reviewed was Colombo in 2014. They reviewed the evidence as to the mechanism of how riboflavin might work in the prophylaxis of migraines in adults, so the physiopathology in 18 to 65-year-old adults as well. They concluded that 400 milligrams a day of riboflavin for at least 3 months reduced the migraine frequency and duration. So they considered that a future combination of treatments may have a synergistic effect on treating and reducing migraine by affecting the brain hyperexcitability to slow down the duration and frequency of migraines. Additionally, they reviewed that the American Academy of Neurology, American Headache Association guidelines, and the Canadian Headache Society also all agreed that riboflavin is effective and recommended in the prophylaxis of migraine in adults. In AMBR in 2011, they studied the efficacy of lower dose oral riboflavin at 100 milligrams per day with oral propranolol 80 milligrams a day and the reduction of migraine frequency and severity. They used 100 adults ages 18 to 65. Diagnosed with migraines were randomized to receive either oral riboflavin 100 milligrams a day or propranolol 80 milligrams a day for a period of 3 months. The patients were given a migraine diary to record the frequency of migraine attacks, the headache intensity, duration, and to report any side effects. They also found that both study groups showed a reduction in migraine frequency, duration, and severity of headache at the 3-month mark. There was no significant difference was seen between the two study groups in most of the measures, though. The side effects were significantly less in the riboflavin group, they did find, and it was concluded that oral riboflavin at 100 milligrams a day is a safe, equally effective, and well-tolerated alternative in migraine prophylaxis. So to review these results and the comparison of them, I did look at the effect of oral riboflavin vitamin B2 supplementation on adults with chronic migraine headaches, a systematic literature review of the current evidence. So the study population was adults 18 to 65 with chronic migraine headaches. In total, there were 2 RCTs, 4 SLAs in 4 different countries: India, United States, Canada, and Italy, numbering 345 people. The intervention was oral riboflavin supplements. In the trial 1, they were given 400 milligrams a day for 3 months, and there were 90 participants. In the second trial, they were given 100 milligrams a day for 3 months, and there were 100 participants in that. Then there was also the systematic literature review. They reviewed 3 random controlled trials that reviewed 100 to 400 milligrams a day for 3 to 6 months. The number of individuals in that was 317, so they reviewed a lot. And the comparison was to a placebo, propranolol, or sodium valproate in 3 of the RCTs. The outcomes were they found that significant decrease in migraine frequency, over 50% in 3 months. They're in 3 random controlled trials. This is also recommended by the American Academy of Neurology and the Canadian Neurological Association. And they did also agree that there were significantly less side effects in riboflavin in the groups that they tested. And there were 190 participants in that. So my conclusion is the evidence tells us that riboflavin taken at 400 milligrams a day for at least 3 months helps to reduce migraine frequency and duration in adults by over 50%. The prophylaxis is safe, effective, and less expensive than other interventions. It's in addition recommended by the American Academy of Neurology guidelines and the American Headache Association for migraine treatment in adults. In addition, it's recommended by the Canadian Headache Society. It should be considered as an adjunct or replacement for medications with intolerable side effects for people with migraine. The final grade assigned is grade 2 or fair. There are strengths and limitations of what I reviewed and found. The strengths were that the studies included data from 2007 to 2019, where search terms very specific: riboflavin, migraine, and adult. All studies agreed that riboflavin was safe and effective for adult migraine treatment. The duration and frequency of migraine attacks were reduced if riboflavin was taken at 400 milligrams a day for over 3 months. The limitations are these studies only included migraine without aura. There are questions as to why riboflavin is only effective on some individuals and not others. And there has not been long-term research yet on an increased dose that riboflavin may have on the human body. There are some gaps in the literature that I found. There is little research on the limited active absorption of riboflavin taken at one time that is to be effective and absorbed and utilized by the body. 2, the mechanism of pathophysiology of migraine headaches is still controversial. And there is no evidence, no research on the long-term effects of the 400 milligrams a day riboflavin on people that are taking this for migraine prophylaxis. The implications for research and future studies. Implications for research. The researchers hopefully can focus on adding non-conjunctive therapies to enhance riboflavin's effectiveness, or combination therapies adding in other supplements. Researchers can also investigate dosing amounts for children with migraines and adolescents. For future studies, we'll need to study interventions that can work synergistically with riboflavin to increase effectiveness against migraines. Also, different types of migraines with aura can be explored, and dosing amounts for children can effectively be established. There are implications for practice. So practitioners can suggest using 400 milligrams a day riboflavin for at least 3 months to see if that can help a patient with migraine headaches in adults. Practitioners can also point out that sodium valproate and riboflavin have statistically the same treatment efficacy for migraines. And although riboflavin has significantly less side effects and is more affordable than other interventions, it may or may not be effective on an individual. It can also be emphasized that currently it's recommended as prophylaxis for adults by the American Headache Association, Academy of American Neurology, and the Canadian Headache Society. So the evidence is pretty solid on this. Thank you.